A question I get asked quite frequently is, how does Botox work for TMJ? And that's such a great question because if you ask Dr. Google, there's a lot of answers you're going to get. So I want to explain it to you in a way that kind of makes sense. Okay, so first and foremost, TMJ is not a disease. It's anatomy. It's a temporal mandibular joint. It's like saying, I have a shoulder or I have a knee. So we all have TMJ. And what we want to do is give you an example that you can visualize and understand how it works. So I try to think of this complex like a car. The gasoline is our stress, and it fuels the muscles, which is the motor, which then causes the suspension and brakes to have wear and tear. So as we get older, we use these muscles on a regular basis to talk, eat. Sometimes with stress, we clench. Other people at night, they can grind their teeth. So if you think about how much this joint is being used, it is used more than any other joint in the body. So the way I want you to think of this is that it's wear and tear. And just like a vehicle will give you warning signs, our body does the same thing with pain. So in this case, if any of you suffer from TMJ, headaches in this area in the temples, sometimes in the jaw, these are things that your dentist can go ahead and identify for you. Now, because it's a complicated joint, it's going to take a team of people to make you feel better. So the lower part, think of this as the dentists and the aesthetic doctors. We can actually use Botox safely in this muscle to soften it, relax the muscle, and take some of the pressure off the teeth. Now the disconnect in our medical system is that most of the physicians that do this, they don't know how to handle the temporalis portion. This is the part that often manifests with tension headaches. You often see the classic this appearance as they're rubbing their temples. That's usually from the temporalis muscle. So the neurologists that take care of this, they don't know how to treat masseter. So wherever you go, you usually get only half of the treatment. Now for me, I've had TMJ, and when I was about 40 years old, it was terrible. I had daily headaches. My teeth, I had to wear a night guard. I broke some teeth in the back. And as it got worse, so did my symptoms. Eventually I had to be on Imitrex, Neurontin, Lyrica. I did all of these medications, and they were all temporary in relief. And the further it went on, they added more medicine to what I had to take. So finally, I decided to investigate because we knew that Botox can relax the muscles. And I figured out a unique protocol, which I'm going to share with you, on how we can affordably treat both areas. So once again, if you suffer from headaches, if you suffer from jaw pain, it's normal. It's a function of us getting older with wear and tear. So let's go ahead and look at this video. Okay, this is my assistant, and notice that the muscle over here is bulging in and out. She's going to have hypertrophy, which is the muscle gets bigger. You can see it already. And eventually this muscle up here, they work in tandem together. So we need to treat both if they're symptomatic. For us with TMJ, it's used to reduce the force of the muscle so that your clenching and your pain will gradually diminish over time. Let's go ahead and look at the next video.
TMJ joint is a hinge joint that connects the jaw to the temporal bones of the skull. Temporomandibular joint dysfunction, or TMD, encompasses pain and dysfunction of the muscles of mastication, the muscles that move the jaw, as well as the TMJ itself. TMJ dysfunction and pain can result from joint disorders, including wear and tear changes in the disc and arthritis of the TMJ joint, muscle disorders affecting muscles of mastication, and repetitive activities like grinding of teeth and chewing gum.
So if we put Botox safely in this area and it doesn't even hurt, you will hardly feel any discomfort at all. And then in 3 to 7 days, you'll know it's working. When you're eating food, you're gonna get tired of chewing tough food like steak. If that happens, it's a sign that it's working. Think of your mother when you were little saying, hey, slow down, chew your food. And then gradually over time, as the muscle gets weaker, the face gets slimmer. Let's now watch the next video here, and let's talk a little bit about distracting injury and trigger point pain.
The syndrome is characterized by presence of hyperirritable spots located in skeletal muscles called trigger points. A trigger point can be felt as a nodule of muscle with harder than normal consistency. Palpation of trigger points may elicit pain in a different location. This is called referred pain. Trigger points are developed as a result of muscle overuse. Commonly, the muscles of chewing or mastication are overworked when patients excessively clench or grind their teeth unconsciously during sleep.
I'm going to teach you how do we identify the pain. And really what I want you to figure out is your trigger point. By pressing, if any of you can go ahead and press this area now, and by doing so, if you have any discomfort, then we can treat it. And we clench here, and we have discomfort here. I want you to know your pain. I want you to know your anatomy. It's important because it's your warning sign, and every time that you get that, take notes. Is it worse in the morning? If so, you're probably clenching at night. Worse during the daytime, when you're at work, or stuck in traffic? Or is it worse when you come home at the end of the day? All of these are clues that you can use to identify what the pain is. So if you're having any discomfort or pain in these areas and you've tried everything else, then Botox might be the answer for you. Aloha.